Hello, and thanks so much for joining us tonight. I'm Alicia Patillo. Positive COVID cases have gone down 3 days in a row, and this is the first time since mid-December as Omicron tore through Nevada communities. 13 Action News reporter Sean Delancey tells us if this could be the end of this terrible wave.
The sharp rise and now potential fall of positive COVID cases is clear, but rates of hospitalization have held steady. And the team of doctors that I talked to today say even if this surge comes to a quick end, the medical system should not expect a lot of empty beds anytime soon.
The Omicron wave of the coronavirus appears to be slowing, and while the Southern Nevada Health District says it's too early to speculate about the end of the surge, this team of doctors is holding out hope.
Hopefully, like New York, it will drop down into the single digits.
Dr. Jeff Ng and his colleagues say other regions hit before Southern Nevada are seeing a withdrawal of the virus, and SNHD case counts dropping are a positive sign that this region could be heading the same way.
If you look at the previous waves, the ramp up and the ramp down have been very symmetric. So this ramped up very quickly that we were just, for myself, just waiting for the steep climb or the steep drop down, and it seems like we're getting that now. The virus is going to have a hard time finding new people to infect.
But with every new variant, there comes uncertainty. Dr. Dahlia Walks says a dip doesn't mean that the virus will follow lockstep with previous variants' trends.
Many people thought that Omicron would only last 4 or 5 days. We're seeing an encore. And I just had 3 patients today who had a second surge of their Omicron.
This group also believes hospitals shouldn't expect to open up beds anytime soon, even if Omicron fades, as flu and other seasonal illnesses impact more people over the winter months.
We're also seeing that flus and colds piggyback on COVID. So, you sometimes see people with strep throat and COVID, and you see people with flu and COVID. So, it's a common, it's not uncommon.
This team of doctors say that the combination of viral threats over the winter months is why people should not forget to protect themselves from everything. Yes, get vaccinated and boosted, but also get the flu and pneumonia shots as well. Sean Delancey, 13 Action News.